All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today we'll talk about some of the news that I have been looking at, and then we'll do our chit chat as well. So get your questions ready, and let's just look at some of the news and the way things are working, and then we'll answer your questions as well. I saw here Susan said that day is unbelievable. So I hope, Susan, everything is okay. Here is Susan. Unbelievable, exasperating day. I hope everything is okay. Afia said that there is a volcano there in Barbados. So Afia, I hope that you are okay and you're safe. So let's start our discussion. Here are a few things I wanted to share with us. Number one, so of course, this is drbeen.com. This is the Bloomberg's newsletter or the page for the vaccine tracking. And what I wanted to do was I wanted to look at various countries, areas that have given a lot of vaccines already and see how they are doing. So here at the top is Gibraltar, and Luffy is here, and Luffy has started singing the songs of his people already. So so Gibraltar, 101% first dose, 87% second dose. So from all theoretical purposes, they should have reached herd immunity. So that means, it does not mean that the infection would now stop, but infection rate would drop to 1 or below, which would mean infection would become stable. If they become 100% vaccinated, as they show in the first dose, and if that is effective fully, which it is not, then their infection should finish in theory. So let's look at Gibraltar. So here is Gibraltar, a small country with Spain and above Africa. There is a Strait of Gibraltar as well, all that geography that I learned today to discuss with you. So here it is. Look at this. No or 1 new case and 7 new cases on March 16. Since then till April 12, 1 new case. And they used to have at their peak 70, 172. And 1 second, Alexa, what is the population of Gibraltar?
In 2020, the population of Gibraltar was 33,700 people.
So 33,700 people, so small, very small nation. But if you see here, 100% vaccinated, active cases down to 3. And of course, the number of deaths, last time they reported COVID-related death was on March 13. It's almost a month now since any further death, which is a good thing. So Gibraltar seems to have done fine. Now, is it the vaccine only, or it is vaccine plus the social distancing, or with that, with mask or other aspects as well? But here we have Gibraltar. Then if I continue, the second one is Maldives. So if you see here, Maldives have 72% first dose, but only 4% second dose. This is a similar model like UK, although UK has caught up a lot with their second dose as well, but very similar model that first dose is given to a wider spectrum of people or wider population. So let's see how Maldives is doing. Now, look at the Maldives in context of Gibraltar. Gibraltar almost fully vaccinated and 0 cases or 1 case. Here, Maldives is in a similar ballpark from a numbers point of view. So if you see here, 72%, although second dose is not there yet. So this may be first dose is too early. If the second dose is not there, normally second dose is given within 20-30 days. So that means the first dose may have been, the campaign may have been widespread within the first, and we may be looking at them within the first 30 days. That may be the reason that we are not seeing a large impact. So if I go here and say Maldives, I try to see this. So they started their campaign in January, by Feb 5, and then they kept rising up. So look at their rise. So by March 28%, so not sufficient. And then if we go about 2 weeks before now, or let's say 4 weeks before now, would be the one that can give you an idea of even the first dose may be efficacious. So go back to 4 week would be March 12-ish. So if you see here, 25% the administration. So that is not sufficient. And that means that Maldives number that are still showing a higher count are because people have received their first dose, but the first dose has not reached the efficacy level that it should. So ideally now either the second dose or enough time spent from the first dose to be effective, like UK has. So this is Maldives. And I'm not going to go through all of them, but just wanted to see some. Bhutan is very interesting. I generally like Bhutan as well. 707,000 people-ish, so under 1 million people. So if you see here, 56 Bhutan here, 63% first dose only. So if I go here for Bhutan, Bhutan seems to be a very cute country to me. So here is Bhutan. So if you see here, Bhutan actually started administering on April 1st. So to expect much of a result at this time would be too early. So, but still they have, if you see here, 63% population. So if I go to Bhutan, or as Alexa says, Bhutan, so here you would see that there are some cases that are still continuing, and that is understandable because after the first dose to the second dose, as the days pass, that is how the efficacy develops. And they only started administering since this time. So then let's look at UK. So look at UK's 48% and 11.2%. So UK went the similar route, that going out broadly. So if I write here, beautiful results. Look at this. So they just continue to go downwards, which is excellent. So UK 48%, I think that it is not just the vaccine. It is vaccine, some social distancing, etc. Today is 12th April. So UK is actually planning to start opening from today as well. So what is it? This is evening in UK. So did UK actually open up today, or will they be starting from tomorrow? I think today was a Monday and they must have opened up. So it will be very interesting in the coming days to see how it goes up. I wish that they stay safe, healthy, and protected, and they do not have a rise in the cases. But of course, they have made a decision that can have consequences if they are not careful or if their bet is wrong. I think they will be okay. So let's see. So here they are, and active cases are low as well. And then number of deaths have gone down as well, which is excellent. Let's look at Israel as well. Israel's 58.7% first dose, 54.4% second dose. So I think after Gibraltar, they have the best numbers of combination in first dose and second dose. So let's see how Israel is doing. So look, almost 122. I love it. Very consistently, very sharply down. And I hope, and someone from Israel can tell me, I hope there are 2 or 3 kind of groups of people. One are those who are vaccinated and fully vaccinated. Second are those who may not be vaccinated but are social distancing or are careful. And then I'm sure in all societies, there is another group that's, number one, does not want to be vaccinated, which is fine. They don't want to. Number two, group that don't believe that there is a pandemic, and then they are just not careful as well. So I do not know exactly what belief pockets exist in Israel, but generally, whatever are the folks doing, generally society is reaching a point of a very low number, which is excellent. So look at the number of active cases at this time, 3,432. if I go back to their previous, of course, they started from zeros and low numbers. Then after the first tiny, what is that wave, they had 2,000. Then between their third and fourth wave, 8,000, and now they have come down to 3,400 and going downwards. So that is excellent. And if you see here, the number of deaths are actually following that trend as well. So I think Israel is, we should commend them for where they have reached. UK has done very well as well. I was curious to see India. So let's look at India for a second. I want to see Zimbabwe too. So here is Zimbabwe. So check out Zimbabwe. Zimbabwe has, as we have been hearing, Zimbabwe has been using Ivermectin as well. And so here, if you see, this is an older news, but this is an important news, and that is Zimbabwe okays use of Ivermectin after official's death. So I do not know if it is necessary to say after official's death, but we have to be careful to protect patients as well, not to deny them effective treatment regimes, says Health Minister John Kasim. So 28-1. So this is January 28. So an older news. So in Zimbabwe, Ivermectin is being used, I think, used more openly and aggressively. So if we look at Zimbabwe's number, you would see here almost finished. And then in last few days, they once again reported a higher number of cases. Now, is that because people felt that, hey, we are good, we are done, and everything is under control, just like we saw that in India as well? Or there is another reason? Or are these the folks who are not taking ivermectin or not taking vaccine or not caring? Do not know yet. But there is some rise, which may be an incident as well, which is an exception, or that may be a trend we'll see. And if you see, the number of active cases have actually gone down, and now that little rise here increased this, created this little upward tick. We'll see what happens. And down here, the number of deaths have gone down as well. So look at the countries: Israel vaccination, Bhutan vaccination, Zimbabwe. Let's see those vaccinations as well. And then, so if I plus ivermectin. So if I go here to Zimbabwe, here, so really low vaccination, 0.7% population coverage, 0.7% population coverage by vaccine, and still the results as good as vaccine can be, and that is ivermectin for you. So very good results in Zimbabwe. And then final thing, and I'll come back to the chit chat in a second. Let's look at Madagascar and India. So why I'm postponing India is that I would talk a little more about India. So let's see others. So here is Madagascar. So when you ask a question, for example, there was a question by Michael about Madagascar. So Michael, what is the practice in Madagascar? Is it let's look at are they using ivermectin? Are they, so no vaccine information. So Madagascar active cases are going up now. This seems to be a second wave, or 2.5 or something. If you call these waves, I don't. But this seems to be going upwards. Active cases have gone up. So there is a second wave developed here. And unfortunately, the deaths have followed. So Madagascar has another wave going on. If they're not, are they vaccinating? Are they taking ivermectin? Are they taking it carefully? It does not look like it's doing good. Now let's go to UK. For UK, we saw US, just my country as well, for comparison's sake. So we have actually started rising again. That is the weird thing about us over here, that we just keep getting these waves. I hope that they stay small and then the vaccination is increased and we are back to normal, or ivermectin becomes an openly available item, and then we can control ourselves. Number of deaths are reduced, which is good. So that is US. And now let's look at India. So here, if you see, this is once again a larger peak, larger in terms of number of cases on daily basis. So in temporal relation, in time relation, it is more, it is rapid, and it is not good that it is rapid. The question is, look at this second wave here. The question is, are the deaths following? And yes, they are following, and that means they would be, unfortunately, the folks who are ending up in hospital in this wave within next 4 to 6 weeks. Unfortunate situations would occur, and these would be reflected here. So not doing very, very good. And once again, when people continue to, I got some messages over the weekend as well. The vaccination level is low. It is not a high vaccination level. So if I go to India, compared to the population, so India, look at this, vaccination 3.8%. So if I go down here, the only question I have is why here is India. So 3.8, I think it is 6.7 and 0.9, right? They should have made this. So first dose, second dose. So if I go back to India, 6.7% of the population and 0.9% of the population, that is not going to do much. And a cool bean from India had sent me a note as well that I have over here. It is a very interesting study. This is not Mubin trying to badmouth India, but actually from a cool bean from India sent it to me. How India lost the vaccine war. I think that it is kind of early, but the basic gist of this article is that in the other countries, for example, compare that to US, India to US, and keep in mind the context is that in India, we have Serum Institute, and by we I mean the world, the India, they have Serum Institute that is world's largest vaccine manufacturer. So they used to make 1.5 billion doses a year for other vaccines. And now came the pandemic, and they have a partnership with AstraZeneca, with Oxford, and they are making AstraZeneca, and they are a private company. The article kind of compares that in the US, with the Operation Warp Speed, the government decided to give billions of dollars to the companies to make vaccines, to do research, to accelerate the production of vaccines, and compare that to India, where the Indian government did not support the Serum Institute as well. Now, I do not know the political aspects of it. I do not know there is politics involved. I do not know if there is a competence of the leadership to go to the government and say, hey, do it, or the understanding that the wave will be there or not. I do not know any of that. I'm just kind of looking at this article's point of view and sharing that with you, that they are saying that, hey, government did not pay attention to the vaccine manufacturing for their own folks and did not support the organizations like Serum Institute to be able to scale up. And so now the Serum Institute is stuck. They have billions of orders, but they do not have the right capacity. For example, compare that to the US. Over here, enough money was given to the plants that are making vaccine that they could hire the the agencies or the workers who would repair the plant if something breaks, to be present on the plant, at the plant all the time. So if something breaks, they can very quickly go and repair right then and there, compared to the policies with the Serum Institute, which may not have those capabilities or that scale capability right now, although they have a large scale. So this was the discussion for India. Now, there is one more discussion that I saw while I was taking my weekend off, And that was the study from Israel, which showed that Pfizer may not be enough effective. And we had discussed Pfizer a few days ago, where it showed that it had good efficacy against South African strain of variant. So this evening, today, I would talk about this as well. So I think it is less time right now to go deeper into analyzing what they meant. I'll give you a hint. I have tweeted that yesterday, and the authors had then followed up with a tweet. What they did was they said, our study was only to see that people who are partially vaccinated, and I'm paraphrasing, this is not the exact word, so I may be wrong when I'm paraphrasing, but I think it is pretty close to what they said. We wanted to understand people who are partially vaccinated. That means they have gotten one dose and they are not fully immunized, or they have gotten two doses and have reached the full immunity of, which is plus 7 days of the second dose. During this time, what kind of variants were infecting those who were vaccinated? So that was the basic study they did. And what they found was that most, I think 8 cases in the vaccinated and 1 cases in the unvaccinated of the South African variant. Based on that, they said, hey, this looks like South African variant finds it easy to infect those who are vaccinated. But, and they use the breakthrough, which then every media and journalism folks, routers and other, they picked it up and they used that word because that was a very sexy word for them to use to get more attention. But essentially what the authors were saying was, during less protection time, what kind of a variant is there? Then the author said that, well, this variant actually spreads less. So there is some interesting analysis to be done on that data. And finally, in their own tweet, the authors, they had a point-by-point discussion of their study. And in the point number 6, they say, there has been 0 infection post 14 days of the second dose. So this was really before the vaccination was completed. And it should not be something that should scare too much, because after 14 days, once the vaccination is completed, or maybe plus 7 days of the completed, there was no further infection. So I'll discuss that in a more detailed fashion this evening. Some people are using that to say, hey, celebration, look, vaccines don't work. And some are looking at that and saying, hey, the data does not look right. Can you tell us more? And then they are able to see that author's thread. So it is interesting that at this time, there are both wings who are trying to look for the news that can strengthen their point of view. Okay, so here we are. So thank you very much for listening to my initial news roundup type things. And let's see how you are all doing here and if there are any questions here. So Maro has a question. Natural killer cells live in the innate arm, but they are part of the T cell trained cells. So how do they come to be in the innate arm and kill indiscriminately? Thanks. So very good question. I'm going to draw this, Maro. And so what happens is, the reason natural killer cells, so here, let's say this is a lymphoblast. Lymphoblast will be a cell that gives rise to a lymph cell, let's say T cell or a B cell. So the lymphoblast gives rise to, let's say, T cells, B cells, and natural killer cells. So this is true that the natural killer cells are actually derived from a parent cell that gives rise to adaptive arms. So if I make the 2 arms over here, so this is innate arm. Innate arm has cells like dendritic cell, macrophages, neutrophils, and then let's say this is adaptive arm, and adaptive arm has T cells and B cells primarily, helper T cells, cytotoxic T cells, and B cells. Natural killer cells are derived from the parent that gives rise to T cells as well. But functionally, they have learned to be in this area. So how did they started doing that? That may be part of their life. I mean, those who believe in evolution might think that this is a change in their DNA at some point, and they evolved to become more innate arm-like. So it is not that they were actually T helper cells, and then they, after becoming T helper cell, they learned to not become T helper anymore and learn to be natural killer. Their behavior, once they differentiate into natural killer, their genes that are open in their DNA are those that help them become part of the innate arm. That means they become indiscriminate. And that is how this is. Those who believe in creation, they would say, well, the God put it that way. Those who believe in evolution would say, this is how they started evolving. So this is their behavior. So the summary is that they're derived from those parent cells that give rise to adaptive arm, but these cells break ranks from the adaptive and they go and work in innate arm. Beautiful cells, I love them. Okay, so Truth Seeker says, if someone is taking Avermectin as a prophylaxis, as described in the FLCCC protocol, once on day 1 and 3, and then every 15 days, and during this time is exposed to COVID-19 positive person, okay, should he now take the dose for exposure prevention on day 1 and 3, or should he wait for symptoms to occur and then take the early outpatient dose for 5 days? So, of course, FLCCC is not very clear about that. I would just give you my thought that if this had happened to me, what would I do? So if this happened to me, let's say if I knew that somebody was COVID positive and I got exposed to them, then what I would do is I will actually take it continuously for 3-4 days, 5 days, because this is the window of time during which the symptoms appear. So I would take it, and I'm talking about myself. This is how I am. I'm going to start taking it on daily basis for 4 or 5 days, and then I'll go back to bi-weekly if I do not develop symptoms. GB says, Indian pulmonologist said that ivermectin plus doxycycline combination is the best. What are your views on it? Absolutely. This was original as well. So azithromycin and ivermectin was originally said. Then Dr. Alam in Bangladesh, he said that doxycycline plus ivermectin was doing very well. And so, yes, this combination is totally fine. So slightly slanted salute says, where is the typical flu these days? I have talked about this many, many times. And again, I always, when somebody asks me this, I always say this: if you're cynical, that is a different answer or question. And if you are just curious, there's a different answer. I had said it about 6 months ago when news media started making noises that this winter is going to be horrible. We will have flu, and then top that off with COVID, and the world is going to break and the sky is going to fall. And I was saying that we would not see much flu this year. And the reason for that is very simple. We are so ultra careful. We are wearing masks, we are doing social distancing, we are washing our hands, we're keeping the elderly protected. If somebody is not keeping it protected and listening to my message and saying, oh, well, we didn't do it, then they are making a mistake. I am not talking about them. I'm talking about those who took part in general protection mechanisms. After that, how can flu spread? Flu spreads in the similar mechanism like COVID. It is a respiratory disease. So we were taking so much care about not spreading the respiratory disease. So I used to get very severe respiratory disease every year. Some sort of common cold would catch me and I would become sick for 2-3 days. This year, I actually did catch a common cold. Cool beans are aware of it, that I thought I got COVID, but I did not fall with it. It was just a very mild case. So we have been strengthening our immune system with vitamins. We've been eating better. We've been taking care of ourselves. We've been very careful. Why would you want to now say, where is flu? So slightly slanted sleuth, I know that this is a common set of questions in those who actually also believe that there is no COVID. Dude, when you say why is COVID spreading, we know that COVID is much more contagious. I know that your second question will be, well, the COVID is not contagious. So I can't work with these kind of things. But COVID is still spreading because it is contagious. And the flu used to spread in those who were in a more older age. And COVID took them down first. And then it is taking others out who are going out without masks and crowding and not being careful. So let's continue. Atul Khan says, any data study about severity of cases, hospitalization, death after reinfection? Not yet, but I think we would soon have that. Pfizer did have that about the infections after vaccination, but just reinfection based, no, I have not seen yet. Paul Davy says, is there a link with the vaccine and tinnitus? No, but there has been reports of tinnitus with vaccines in the vaccine own FDA briefing. Plus, there have been reports of tinnitus with vaccines in VERSE. And there have been cool beans who have talked with me about them having tinnitus now for a couple of months after the vaccine. So there is a link, but there is report of that as well. It seems like there is less attention to this. And I feel that this is causing damage, that some people would develop tinnitus forever. So for example, in case of Johnson & Johnson, if I am recalling correctly, I may be wrong, but one of these three that are in the US, I think it was Johnson & Johnson. They said 6 people developed tinnitus and 1 was unresolved and the others were resolved. So this can actually become an issue for a long time. And I would remiss if I did not mention this. Dr. Drew had the infection, and when he was recovering, his tinnitus was bothering him. He had developed tinnitus, and he said fluvoxamine helped me a lot with tinnitus. BI says, Dr. Bean, can you give your opinion on whether someone taking fluvoxamine, fluoxetine would have reduced reaction to the vaccines? Can you do a video on that like you did for ivermectin and hydroxy? So fluvoxamine, and if it can, so I can tell you right now that it will not. So just looking at 2 mechanism of actions, and I can do a video as well, but just to provide some update here. It has 2 main mechanism of actions. One is to reduce the serotonin reuptake. So serotonin would stay in the brain and in the synapses for a longer period of time. So that has nothing to do with the efficacy or with the vaccine. Serotonin levels and vaccine have no relationship. Second part is that it is anti-sigma 1, which then is, you can say, anti-inflammatory. That is very similar to ivermectin, anti-inflammatory with a nuclear factor kappa B. So here it is also anti-inflammatory, but that is not sufficient to disrupt a vaccine. I can do this talk as well. This is a good point. Margaret is saying, Susan Pick, my prayers are with you. Be safe, healthy, and try to find joy each day. Please let me know if you need anything. I hope, Susan, you're doing okay. Free Rider says, waiting for your views on sanitize. And I have done 2 discussions already. So I did a talk about sanitize and how it is awesome, and then and how it works. And then I did another talk about their study and then their approvals. So it is working. It is good. Cassis Brooks says, good afternoon, Dr. Mobeen and everyone on stream. So do you know that I am on Twitch as well? This is thanks to Bonk Bonk from UK that he helped me connect with Twitch. Although I do not have the stream creatives, but hey, we are on Twitch as well. GB says, in India, the health system is going to a near collapse. And that is what happened in the US as well. It happened almost in every country. When Italy was experiencing the issue, it happened there as well. So meaning, I want to make sure that we don't bash some country unfairly. They have a very large population. So slightly slanted through says, I'm not cynical, I'm curious. Thank you very much. And please, following up more for you, and then I'll go back to the India's point. The flu, when it used to spread, would not spread to everyone in the past. And now when COVID came, it just totally took over because its dynamics are very different from flu. It cannot be matched to flu. There are so many other respiratory infections as well that people get, but they are not as contagious. It's not just the flu that we get every year. We get influenza virus, and not everyone gets it. And influenza is also respiratory. So while they are respiratory, their dynamics are different. COVID has a huge advantage that we never had COVID before. So it just can catch us very easily. So going back to the India. So one, they have a very large population. Second, I feel that they had this second waves and gave them a lot of confidence that we're good. And so then the Holi came, and then the Kumbh Mela came, and then the elections came. Then there are some states that said no Ivermectin. So there's a combination of all of those things that have caused issues. And when people would get sick, then the medical facilities are going to become overwhelmed. Randon says, is it normal post-COVID symptoms like dysphagia? So it is the inflammation in the throat area, or it could be neurological. Dysphagia can occur because of the local obstructions or local difficulty, or it can be because of the neurological things that the nerves that fire to help us swallow, they're not firing correctly. That would also cause dysphagia. So both are possible with COVID. Neurological symptoms and with local inflammation. Akash says, sir, did you hear about the budesonide study that came out in Lance? Please give us your thoughts. That is beautiful. I actually am a fan of budesonide. We interviewed the budesonide the doctor who started using budesonide here in the US. So I'm going to take this down as a note for me to discuss it. I hope that the study found similar good results as well. France is here. Hey, France, how are you? Moonshot says, thank you. Randan says, thank you. My own experience with vaccine. So vaccine, you can think of that as a tiny bit, a taste of the infection. It's not the infection, but it is kind of a taste of the infection. And to give you a little joke here, when my children were very small, I think my younger son was 3 years, and 3 or 4 years we were here in the US, and we went out and somebody had a dog, and that dog came and started licking him, and he started crying, and we said, hey, he won't bite you, don't worry. And he said, but he is tasting me right now. So he thought that it is tasting him, and then it would bite him if he's yummy. So this same thing is that the vaccine is really a very tiny, small taste of the infection. And my own experience, my ears became inflamed, my throat became inflamed. I was congested for 2-3 days. This weekend is the one that I started recovering. My wife's her knee joints, even this morning she said that, hey, my knee joint has started hurting again. So I saw that those inflammations or areas in our body that already have the inflammation going, that inflammation increased for some days. So my question to the cool beans over here, can you explain why, if there is an already going on inflammation, why a vaccine would trigger that or accentuate it or amplify this? Can you tell me the mechanism? So this is your question for today. Jitendra Kumar says, why after 100 years diabetes cure is not found, but corona vaccine available in market in sort of time? does this part of medical scam? So Jitendra, very good question. If the cool beans have time, I can explain what is the difference in these two. If you are curious, I'm happy to discuss it. If you're just upset, then we can not spend time. So slightly slanted salute says, is your immune response going into defense mode, right? Kind of on the right track. I don't want to give you the answer yet. On the right track, but not there yet. Clopidogrel can lead to TTP and then brain clots after wax or even without wax. This I need to check. Can you send me some link or something on Twitter? My Twitter is at Drbeen_medical. And I can then look it up. Okay, so Salman says yes. So Salman, is that the yes to the Jatinder's question? So Mike Oliver says, I have long COVID, constant brain fog, chronic fatigue, chronic joint pains. I said, what is the latest prognosis treatment? Should I get a vaccine? So Mike, couple of things. And again, not directed at you specifically, generally what I have heard from my colleagues who have been practicing and from those folks who have been researching long COVID and from our work on the studies. Number one, there have been a few cool beans that have directly sent me message. So this is anecdotal. Some folks saying it, we have to take that on the face value of it. I don't feel that they would like to lie to me to make up something. A few cool beans have sent me this, that, hey, I had long COVID, I took the vaccine and it helped me and my long COVID is gone. So that is one. Second, there is another cool bean who was really annoyed by long COVID. She was really bothered by it. And then one day she commented here and she said, interferons have made my long COVID vanish. So second part is interferons. Third that I've seen is that Ivermectin weekly helps a lot with the long COVID. But the experience I'm hearing is that when it is stopped, then the long COVID symptoms bounce back. My own experience with my patients, maybe I have never had patients who ended up in long COVID. My situation was one patient, young doctor, she became long hauler after recovering. 2-3 weeks later, she said, I continue to stay fatigued and I have fever and tiredness, and I cannot sit upright to study anymore, which I used to do. Young woman, 23, 24. And I was managing her before, so I gave her a pulse of steroids, 6 days of prednisolone with tapering, and she became okay. Then one more person who was about 62 had a comorbidity of cancer, had a shoulder surgery. After that surgery, he had developed the long COVID, and he almost died with that. It became so bad. So I managed him, touch wood, with the grace of God, with the lucky stars, he recovered. Then 2.5 months later, he became long COVID and he started having symptoms. And I gave them 2 therapies of steroids and they recovered from that completely. I actually spoke with him 2 or 3 days ago and he is totally doing fine. So I think that in addition to ivermectin, low dose steroid for a longer period of time is a very important thing as well. Then another nugget that I got was that those folks who have long COVID with neurological symptoms, one, that the neck massages, and I have done a talk about this, that the brain fog and others, and neck massage and the spine pumping, that is moving the spine like this where it pumps. Spine pumping and the neck massages really help a lot with the neurological symptoms, and fluvoxamine like drugs help a lot. I always give this comment with fluvoxamine, and people protest to me that why do you always make us scared? But it is important. Fluvoxamine can have a side effect where a person can become suicidal. So because there is that side effect, I always have to say this so that people don't go and start taking it over the counter. Take it with the help with the doctor. So fluvoxamine has really helped those long COVID who have neurological symptoms. These are the ones that I have seen so far people taking. Colchicine has been used as well. Other fluvoxamine like things have been used as well. In addition to that, keep your vitamins, keep yourself relaxed. And this is what is out there. There has been a study about mast cell activation syndrome as well. And for mast cell activation syndrome, there have been antihistamines that can be used. So that is another area that can be used as well. So this is the these are various therapies that I have collected over the time. Maybe Mike, you and I can put together the same clip that I just spoke. Maybe we can take this clip out and create a little web page from this and maybe put together. Okay, 15 more minutes. Colin Hamel is here. Colin, how are you? Can you get Dr. Jackie Stone, Zimbabwe, on at some stage, please? Yes, I can. So let me write it down. Dr. Jackie Stone. Okay, will do. And Colin, is it possible if you can connect with her as well and help me find her? And folks, please, I try to stay neutral on religious basis, on political basis, on race basis. I try that I don't say things that somebody would say it is right or it is wrong, and we just stay focused on the information. So if I said with the grace of God, or if I say touch wood, I have had, when I say touch wood, I have people who come back and say, what do you mean by touch wood? If I say lucky stars, people come back and say, what do you mean by lucky stars? Oh, where are the lucky stars? And same is the message with God as well. Just take those as an expression to say, I am grateful that the person survived. That is the point. I am happy that the person survived. And these talks that I do, it is now a year, 3-4 talks every day, are to help protect. And so when somebody is protected and safe, it makes me happy. It makes me grateful. It makes me thankful. Jess Alvarez says, I was given Remeron to treat long COVID. I asked for fluvoxamine, but my physician said that was better. Your thoughts? I have to look at Remeron's mechanism of action and comparison. Fluvoxamine has two actions, and one is the SSRI inhibitor, or the serotonin reuptake inhibition, and the second one is the anti-inflammatory. So, plus this molecule was used. Look, Ivermectin is an antiparasitic as a known molecule. And then they found out that that molecule can do more functions as well. Even over this weekend, somebody had tweeted to me, I believe, or sent me a comment or written a comment somewhere saying, if Ivermectin, an antiparasitic, can help a virus, then is the virus a parasite? This is a very common question that, hey, is Ivermectin, why is it working? Is it antiparasitic? But it's a molecule and it can have more functions. Similarly, fluvoxamine is studied to have this function. Because other drugs, they may be better, they may not have been studied as that molecule. So we can't say that, hey, because it does the same thing, it is going to be, maybe there's a different part of the molecule that is working in a different way that we do not know yet. So because of that, I usually only go with the medicines that have been studied. I'll give you an example. Ivermectin is an antiparasitic. So can we pick up any other antiparasitic and say this would work as good because it also is antiparasitic? And the answer will be no, because Ivermectin has a molecular shape that does some extra function. So without studies, I can't say this would happen. George Smooth says, guys, don't forget to like and share. And George, thank you very much. I see Avermectin Man over there. Ivermectin Man is awesome. Um, let's see some more questions, and let's go on for 5 more minutes, and then we would stop. That gives me a break between the two meetings. Ingen says, hi, Dr. Mubin. Hope all well. Best from Ireland. Got message from your support team. Okay. So I will catch up with them. I have a meeting with them after this second meeting, so I'll talk with them. Prem Prakash says, people in India have started us taking aspirin as a prophylactic. Will they face complications, sir? Taking usually aspirin is pretty benign, pretty harmless, but it is also that a person's own condition, their liver's condition, their blood's condition would then tell should they take it or not. So they should work with their doctors. But I understand that if they're taking AstraZeneca-like thing, then there is a need. I did that with my wife. She took Johnson & Johnson, so I gave her blood thinners. And she kept having headaches till this Friday. And that was a scary time because that was also the day 5th. And she started having headaches on day 3. And then yesterday she complained of headache a tiny bit. I kept giving her blood thinners, and today she did not have it. So now, was it Johnson & Johnson, or was it just regular headaches? Don't know. Carly Medley says, yes, Dr. Bean, please create a clip summarizing response to Mike about long COVID. I'm a cool bean with long COVID for X4 mates living in NM. I've not been able to get help here yet. Thank you very much. Okay, so someone has to tell me where I spoke this. So this video, I have to take a note of this one to go over and then put this together as well. Will do, Carly. So Opinionated with Nicole says, would you take J&J or Pfizer if you had the choice? So I had said this before as well. If there is nothing else available, I'll take whatever vaccine is there. My first preference and liking was Novavax, but Novavax is still taking time, and I just didn't want to continue to wait and keep thinking, I've taken my Avermectin, what would happen tomorrow, and should I go here, should I not go there, and so on. So Novavax I loved. Then second was Moderna's, Pfizer's. I would have probably taken an inactivated virus more over the adenovirus, because adenoviruses vaccines have been out there for a long time, and they're known to be triggering the blood clotting. Although we saw with this Florida person, the one who was doctor and developed thrombocytopenic purpura, he did not take adenovirus. He, I believe he took Moderna, and he developed purpura. So that means other vaccines can cause this issue as well. But Johnson & Johnson, just like AstraZeneca, is adenovirus based, just like Sputnik is also adenovirus based. And that is known to cause this platform is known to cause purpura or bleeding or thrombocytopenia. So because of that, I would be hesitant. But my wife and she, I went with her when we went into the vaccination area, and they said, today we are giving Johnson & Johnson. I said to her, don't take it. And she said, I want to just continue to move forward. And she did. But then I supported her with blood thinners, and she did complain of headache, and I did become scared. But fortunately, she's okay. So this would be my concern. If that is the only option, I would take it, but I would have myself ready for that blood thinning issue or thrombosis issue. Hum says, I love how you seem to be more hesitant in recommending aspirin than Ivermectin. Shows how much you believe in its safety. Ivermectin is very safe. Aspirin can cause, in folks who are not whose health may not be up to speed can cause bleeding, and that can become bad. Ivermectin is safe. I love ivermectin. That is why we have the ivermectin man. Abe Moment says, one week in with ivermectin for long COVID, no change. Any thoughts? Continue. So again, not a specific, sorry, I just came out of my mouth, not for you, but in general, ivermectin like drugs need to go on for a few weeks to be able to make their difference. Plus, I have seen, look, let's answer the question, why ivermectin? And I need to break as well. So let's take this as a last question. Let's answer this question, that why ivermectin? Ivermectin is, let's say, weak anti-inflammatory. So if somebody has inflammation, then ivermectin is not really the right answer. Then steroid therapy would have to be the right answer. Because steroid would cover inflammation, which is originating from the immune system, by suppressing the immune system, not suppressing, but modulating it. I'm talking about low therapy steroids. On the other hand, if the virus is hidden somewhere and causing the system to be bothered, then ivermectin can help, because it can help eradicate the virus or control the virus. And that is why vaccine can help as well. So I have done this discussion in the past as well, that for long haulers, they should not just stick to one solution. They have to experiment. And they have to experiment based on what may be causing the problem. Is it the macrophage activation syndrome? Is it the virus sitting somewhere and getting triggered? Is it the immune system that has become mutated because of the hit and run theory of the virus attacks? And for all of them, the solutions are different. So the long haulers have to go from one solution to the next to the next. And maybe we should do a dedicated video only about the long hauler possible solutions and how they should try various things. And then if something not work, then they can rule out that, fine, I don't have a virus hidden somewhere. Okay, my immune system is not doing that well, so let me modulate that and then see what happens, and so on. So somebody asked me about aspirin. I think I had given her 250 mg in the morning and 250 in the evening. So slightly more than but please don't take this. Aspirin can cause issues as well. So be very, very careful. Talk with your doctors. I am just discussing what I gave to my wife. And I was with her all the time, and I was observing her. I knew I can stop this if I needed, and so on. So last question, and then we stop. So GB says Sputnik V is same as AstraZeneca and J&J, so same chance of blood clots. Yes, so the adenovirus-based platform does have this chance of causing blood clotting, and if that is the case, then Sputnik would be in that ballpark too. Cool. Janna says, Drbeen, I pray for you and your wife. You're well. So this is, you sound congested. Yes, I usually am congested in the morning because of allergies, and then I start recovering over time. But I'm not in that kind of a state where I was before this weekend. I would be hurting here, and I would be swollen, and I would have to take medicines continuously. It was just bad. The vaccine had triggered it. So my question once again to Cool Beans, what caused a person who had the knee joint pain before, what increased it after the vaccine? And I had some congestion here, what increased it after the vaccine? That is your homework. We have discussed these kind of mechanisms before. So I would see some of you this evening, and the rest tomorrow. Stay safe and healthy and happy. In the description of this video, one, please like, subscribe, and share. And secondly, if you would like to support this work, there are 3 links in the description. One is to buy me a coffee, and the other one is if you would like to support this in general. There's a PayPal link for that, and then there is a link for becoming a patron as well. So thank you very much, and I would see you this evening or tomorrow.